I meet lots of patients who have had their frames purchased by loving family members and or given to them from friends. And although this is really lovely, it's really important to know that each frame has a little bit of a different use and may or may not be suitable for your older person. So this is just a quick video to go through the different types of frames and who they would suit best. So remember that this is general advice only. I haven't seen your older person, so I don't know if it's the best frame for them, but this is just a general guide. And we know that frames are fantastic in keeping our older people mobile. So oftentimes a frame will allow someone to walk a lot further than if they were just walking with their walking stick. So it's a really good way to keep them mobile and safe because by holding on to something, it makes them less likely to fall as well. So these are the different types. So the first one is a pickup frame. So I recently had a patient who had a tibial fracture. So that's a fracture in their shin. It's an osteoporotic one. It happened because of her osteoporosis. And so I didn't prescribe this. She was sent home with it from the hospital, and this is a pickup frame, so it's nice and light. It's an aluminium frame. It can easily be folded for storage. The goal of this is to you pick it up, you lift it in front of you, and then you step into it, and you just repeat that process. The issue is that it doesn't provide a very natural gait. We want a gait that is continually one in front of the other, not stepping into, hold, stepping into. That's not a very natural gait, but it is best for people who have had injuries like fractures, and instead of putting weight through that sore leg, they can put weight through that mobility aid. So the pickup frame is a really good one in that case, because it might be ideal that people have crutches, but if they don't have the balance for crutches, a pickup frame is a really good substitute. So the next one is a rollator frame. So it's similar to the pickup frame, but these ones have two wheels at the front and they have two skis at the back to help it be able to easily be pushed forward. It allows a very natural gait. It's very light again, can be folded for easy storage. The wheels aren't fantastic for outdoor use, so it's really better for indoor use. But the issue is that if you want to walk around the house, if you need to carry something, you can't really do it because you've got to have both hands on the frame. So you're not able to take like a cup of tea or a plate with them. So this is where a tray walker can come in handy. It's got four wheels, but because they're really small and they're for indoor use, it's really easy to navigate inside the house, and it's safe so that they can go into the kitchen, they can fix themselves a cup of tea and a sandwich, place them onto the tray table and safely walk them back without having anything in their hands. I've seen patients also just use this as a tray table next to them, and then when they need to use it to walk, they'll just wheel it in front of them and then they'll walk, and then they'll put it to the side and use it when they're not walking. The next frame is a three-wheeled walker. So here we're getting into the heavier, they are sturdier, but they are, because of the bigger wheels, they are for inside or outside use. They have brakes. So the brakes near the handles, you can either push them, squeeze them as you're walking, or you can push them down as well. The ideal situation for this is that it's indoor use, or you need to navigate areas that have like tight corners, narrow hallways, things like that, where a normal four-wheeled walker just is a little bit too wide. So it's a great substitute to have. You've got to make sure that you can fold it into each other, but when it's folded out to be used, you've got to make sure that that little lock is fully in place, or else it will collapse. So again, the person who uses this needs to be aware that how to use it correctly to make sure that they are safe and they don't fall because of incorrect use. So the last and most popular type of walking frame is the four-wheeled walker. The advantage of this one is that it has a seat. So if people were going to walk outside. They can walk to the shops. They can have a seat if they needed to. So really good for people who have balance issues as well as even just cardiac issues, and they're like they just need somewhere to safe to stop and sit, and you don't know sometimes outside where you can do that. The frame provides its own seat, so that's a really good advantage. It's got brakes again, which you can squeeze or push down. It's got 4 wheels, and they are for indoor outdoor use. The important thing with this one is to make sure that it's being used correctly. So the correct way is that it needs to be an appropriate height, which is up to the level of your wrist. So if you were standing up straight, the older person, to measure it against them, you want that handle to go against their wrist, so that when they're holding it, there's a little bit of a bend in their wrist. A lot of my patients like it taller. I let them know that that's not the ideal height. The height is at their wrist, but a lot of them like it higher because they feel that it helps them stand up straighter. I don't argue with them. I don't think it's a huge safety issue. I just let them know that the best height for them is a little bit lower. The issue with people bending on the frames and why they compensate by trying to put the handles up is actually because people stand too far away from the frame. So they'll push the frame like this and their body's quite far back. The ideal position when walking is that you've got the handles are by your sides, your feet are between the rear wheels, and you just walk in a natural gait in front of you. So you just gently put a little bit of pressure on it so that it helps your balance and you just walk forward. Unfortunately, a lot of people will try and use their elbows onto it. There's another type of frame which can be used, but it's not a very common one. Um, and the issue with walking so far behind the frame is that a lot of older people will complain of more shoulder pain and more back pain because they've got poor posture when they're walking. The other issue is that if you've got an older person with dementia, we need to be mindful of what they're used to and what they can remember, because a lot of people with dementia, if I gave them a new frame, they're not going to know how to use it. They'll forget it, and that they just won't take it with them. And the other thing we need to be mindful of is for people with dementia is that they may not be able to walk around the frame safely, and so that their feet can get caught at one of the back wheels and they fall. So as you can see, these frames are fantastic. They help our older people keep safe, to stop falls, and they also keep them mobile and social, which is fantastic. However, there are risks to each of these, and it really depends on your older person in how they feel being able to um, use the frame safely, and of course what suits their needs, depending on where they live and how they move, and how good their exercise tolerance is. So that's all for today. I hope that helps. If you have any questions, please comment them below. Bye for now.